All right. Welcome to the Buy Blue Shopper YouTube channel. And I have with me the president of Pennsylvania State CLUW, Laura Wentz. And I also have Kathy Black with me. And I want to thank everybody for joining, whether you're on the live or you're going to do the replay. Please hit the like button. And without waiting around any further, let me introduce Pennsylvania State CLUW President Laura Wentz.
Hello, thank you, Kay, for having us today. I just want to let everyone know. So I'm the president of Pennsylvania State CLUW Coalition Labor Union Women. We are a co-ed coalition fighting for women's rights, union rights, worker rights, human rights, Mother Earth's rights throughout the country and the world. And we have sponsors for this. This is our series of events. And I'd like to thank our sponsors. We have Philadelphia Joint Board Workers United. We have Philadelphia AFL-CIO. We have Kathy Black. We have Pam Tronsor, honoring CWA Union Sister Extraordinaire Sylvia Ramos. We have myself, Laura Wentz, and we have Best Insurance Pro LLC, Jeffrey O. Jones, Vice President of Sales. We do have a couple other sponsors pending, but we do not have confirmation of them just yet. But we will be adding them in the very near future to our list of sponsors. And we do have more series events to come, and I will give you that information after after our session with Kathy Black, who is going to be talking to us about the Family Care Act for Pennsylvania. She is a strong advocate for women and all of our rights. She's a mentor of mine and has taught me so much about fighting for our rights, protecting the rights that we have, and plowing the way for the future of women and unions and workers in our community. So take it away, Kathy Black.
Hi, everybody. Thank you very much, Laura, for the introduction, and thanks for the invitation to come on your new Facebook channel and talk about this important family care bill that is currently in the Pennsylvania legislature, and we hope going to be voted on this fall. This is great timing, even though this is not a new issue by any means. It's perfect timing to hold this because this informational session, because we really want to get people active and involved and try to get this passed this fall. So union and advocacy groups have been working on getting some kind of paid family leave program ever since we first got the Family and Medical Leave Act way back in the Bill Clinton administration. But as I'm sure you all know, that only provides for unpaid leave, and it does provide for health benefit coverage and some job security, but it doesn't help people who really can't afford to take leave when they or their family has a pressing need, something personal, birth, care for a elderly relative, or your own health needs. So the movement has grown over the years quite dramatically in recent years, and we've had a lot of successes. Many cities and a few states around the country have paid sick day ordinances, and in fact, for our Philadelphia chapter, it was our primary issue campaign that we worked on for many years. Here in Philly, we had to pass it 3 times before we got the mayor to sign it, and it actually went into law. But it's now been in place since 2015, so we've got 9 years of paid sick days for hardworking Philadelphians, and actually we got some extra protections and extensions during the COVID pandemic time as well. So 13 states plus the District of Columbia have enacted programs similar to the one that I'm going to talk to you about today that's proposed in the Pennsylvania legislature. These have already been up and running for a bit, including our own neighboring states of New York, New Jersey, and Delaware. And at least half a dozen other states around the country have proposed legislation that's working its way through their state legislatures. This issue got special attention. Really, the COVID-19 pandemic brought the need for a program like this into very sharp focus for a lot of people. The experiences of these other states show these programs can be successful. They can help employers retain employees and improve productivity, reduce retraining costs, and they've also been shown to reduce requests for public assistance by as much as 39% after the birth of a child. So if a woman has a job to go back to and some paid leave, she won't necessarily wind up on public assistance instead. And same goes for food assistance. It's a dramatic drop in food assistance requests. In our state, we have a particular issue. We have a very aging population. We're one of the oldest, generally speaking, in the nation. And we seniors are going to need more and more care as we get older. So programs like this one can help families juggle elder care without having to resort to financially ruinous nursing homes, or at least, not as soon. And especially when you can couple these benefits with those programs that are available through Medicare and Medicaid for senior citizens. And then another side of this is that Pennsylvania is losing young people at a rather alarming rate, actually. We need to attract businesses, and we need workers to staff new businesses. So we need to be a state where people want to come here to work. Representative Dan Miller, who is the lead sponsor of the House bill, is famously quotes, "Pennsylvania leads the nation in never leading the nation." And he thinks this bill can help shift that paradigm, not just through these benefits, but by making it a more business-friendly and worker-friendly place and attract new citizens. Surveys show the idea of a paid family leave plan is wildly popular among all Pennsylvanians, and even 56% of employers favor a program like this. But most small businesses can't afford to provide an employer-paid program for paid leave, even if they wanted to. And so this program is actually an insurance program, and it's a perfect solution. And we'll get into the nuts and bolts of that. So there's only a handful of voting days for both houses of our legislature left in the calendar this year. And so the coalition that is working on this bill is determined to make this fall the time we are finally going to get it done. Otherwise, we have to start all over, reintroduce it in January. So what is it that we're talking about here? So I'm going to talk about the provisions of the bill, the status of the bill, and what we can do to help advance its adoption as we enact this. So there's a House version and a Senate version. The numbers are House Bill 181 and Senate Bill 580. And here's the actual description. The bill establishes the Family and Medical Leave Program and Family and Medical Leave Fund. Essentially, it's an expansion of the current Federal and Family and Medical Leave Act, and it sets up an insurance fund to pay benefits to workers who qualify under the bill's provisions. The House bill's chief sponsor is Representative Dan Miller, as I said, and there are 57 additional co-sponsors as of today. The Senate bill is sponsored by Senators Maria Collette and Kathleen Tomlinson. Both of them are Philadelphia suburban district senators, and another 16 senators besides those two are co-sponsors. And very importantly, Senator Tomlinson is a Republican, and she has been instrumental in getting support from other Republican legislators. And in fact, she's running for re-election, and as she is running on her sponsorship of this issue, she's using it in her television ads. And if there was ever evidence that this is a bipartisan issue, there it is. She's got it right on the airwaves. So the sponsors and advocacy organizations are pushing for passage before the end of the year, as I said. And so here's some nuts and bolts about what the program is and would do. It would be administered by the Department of Labor and Industry, and those are the committees of the legislative bodies that have heard the bill and passed it out of committee. and here's the major provisions are that from 1 year of passage, the program must be set up, and within 2 years of passage, benefits have to be paid out. So in the first year, it'll be establishing all the regs, the rules, the numbers, the forms that have to be developed and all that. Public education, employer education. L&I has all those administrative responsibilities. They'll be determining contribution and benefit levels, providing public education, and they'll eventually, when there are claims, they'll be the ones that will evaluate and adjudicate the claims, investigating the complaints, make annual reports, etc. And there will also be an advisory board set up, made up of representatives from L&I, from the Treasurer's Office, the Insurance Commissioner's Office, the legislative L&I committee members, and then 6 members of the public representing equal numbers of employers and employees. So here's what the bill will do. The leave can be taken for a number of reasons, which are very similar to Family and Medical Leave Act, but I think expand a little bit. For the birth of a child, adoption of a child, or a foster care placement with a family. For caring for a family member who has a serious health issue, including during a public health emergency. Not something they thought about back in the Clinton administration. And for the an employee's own serious health issue, including pregnancy, and it has to be something that basically precludes your ability to the functions of your position and requires you to be off of work at least for some period of time. Any employee who's caring for a family member who is a covered service member due to qualifying exigency leave. So this is a new wrinkle. I don't think that's part of any of the other leave bills that we've seen. This is for people that are in military service but are relieved of duty for some emergency reason and are back in their home district. And then finally, also very important provision, and any worker who is a victim of a qualifying act of violence or is caring for a family member who is a victim of a qualifying act of violence. So this is mostly referring to domestic violence. There's a whole lot in the bill that has to do with what this means and who would qualify and et cetera. But and it isn't only acts of domestic violence, but it's clearly one of the main reasons that this is included in this bill. So what do you have to do to be eligible to file a benefits claim and collect some money? First of all, they're pretty minimal. You have to have worked at least 18 weeks during the previous 12-month period prior to submitting a claim. You have to have earned at least $2,718 in income during the previous 12 months prior to submitting a claim. So those are pretty low bars to meet and considerably lower than the Family and Medical Leave Act requires. Certain proofs will be required, probably depending on what reason you're giving for needing leave, medical certification, proof of wages, all that kind of thing will be required. You won't be able to simultaneously collect workers' compensation benefits. And in the case of domestic violence, there's a lot of very carefully thought out confidentiality measures that are built into the bill. Lots of different varieties of documentation would be acceptable: court restraining orders, medical records, police reports, police charges, or conviction of someone, testimony of others. If you don't have documents, it's a broad array of proofs that they would find acceptable, because they're well aware that it's a touchy issue and not everybody is going to have paperwork. And then again, very strong confidentiality provisions are included to protect the victims of violence and limit the amount of detail that can be required. Married and domestic partners working for the same employer are both eligible for benefits, even if they run concurrently. And this is a really wonderful benefit. A lot of couples can't, and it's not that unusual, especially in like state government or city government, big employers, that a couple will be working for the same employer. And in the past, I know that has been an issue for some couples, that they were not able to get leave at the same time. All right, how much leave can you take? When there's two categories. If you're caring for yourself, if it's you that needs the leave time because you've given birth, or or adopting, or have a foster child in your home, or your own illness, or violence that's been perpetrated against you, you are entitled to up to 20 weeks in an application year. For those that are caring for others, the max is 12 weeks. So, and also very importantly, leave can be taken intermittently or even through a reduced work schedule. So this is really an important kind of provision for people that have recurring health problems, for people that have migraine headaches, for instance, is an example that I used to come up against in my work when I was the health and safety director at AFSCME District Council 47. And, when these people didn't have headaches, they didn't need to take time off. And it was very difficult to get employers to agree to that. But this is written right into the bill that is an allowable use. When the leave has expired, an employee must be restored by the employer to the position that they previously held, or to a position with equivalent seniority, status, employment benefits, pay, and other terms and conditions of employment, also very important provision, and all health benefits that are typically provided while an employee is at work must be provided during the course of the leave as well. It also means an employee who has any kind of copay responsibility themselves will have to keep up those payments. And then there's very strong anti-discrimination language in this bill. Taking of leave cannot be held against an employee. No discriminatory or retaliatory action can be taken, no discipline, even for expressing an intent to take the leave. If an employee has access to other paid leave, their own sick, vacation leave, or whatever, it's their option to use that first and use it up, or to use the benefits from this program first. They can use them consecutively as well, however they want to do that. And as employers, there's one way that they can opt out of the program, and that is if they offer something equivalent or better. It must be equivalent, at least equivalent in every respect, or better in terms of the benefits it offers, the time off it offers. That is the only way to get a waiver from the state. And I won't go into chapter and verse about all the waiver requirements. That's another whole ball of wax. And you won't be employers probably anyway, but that's the rare employer that's going to be in that situation. But there are some. And then even self-employed people, which is probably not going to be our members, but for those of you that have family members who, you can even insure yourself as a self-employed person and still become a participant in this program if something comes up. So these are all really, this is the advantage of having all these years of experience with the family and medical leave. You can tell many stories have been told about where the gaps are and, where people have fallen through the cracks, and they've tried to seal up all those spaces and provide answers for them. So it's really a well-drafted and comprehensive bill. Okay, now here's the section about the amount of benefits do you receive. It's a little complicated, so I'm just going to read exactly what it says in the bill. The portion of a covered individual's average weekly wage that is equal to or less than 50% of the statewide average weekly wage shall be replaced at a rate of 90%. So the first half of what you earn that's equivalent to a statewide average weekly wage, you get 90% of that. And then the portion of your average weekly wage that exceeds 50% of the statewide average is replaced at a rate of 50%. So it's a complex calculation. It's very individualized for each person. It means you will not be getting 100% of your wages, but it will be a significant amount. So, and these numbers will be recalculated every year, the weekly wage, the average weekly wage, et cetera. And then there's all kinds of provisions for calculations that involve gratuities, vacation pay, travel pay. I'm not going to get into all that. I couldn't absorb it myself. And, you know, that's going to be, you'll get that on a need to know basis, and it could change a little bit by the time this passes anyway. All right, now the all important part. How do we pay for this? How is it funded? Well, it's funded by workers, essentially. That's the bottom line. All persons who are employed in the Commonwealth of Pennsylvania will be required to contribute to the program in order to finance it. The max anyone will have to contribute is 1% of their pay, and that those calculations will be made by L&I, you know, if and when this is passed, and you know they get all the data. They'll have to figure out what it's going to cost, and that'll be also recalibrated every year as they see what the experience is, how many people are using it, whether they're draining the fund, whether there's excess. Then will be able to adjust that, donate that contribution level up or down, but it will not be more than 1%. Let's see. The payroll contributions into the fund should commence at least 1 year prior to the payment of benefits from the fund. So that's why earlier in my remarks, I mentioned that the first year is essentially to set up the program. L&I has a year to get it rolling, get all the forms, all the public education organized, all the administrative regulations organized, figure out all these numbers, but then also start deducting contributions so that by another year, hence, benefits will be able to start being paid out. So it's going to be a 2-year rollout. Let's see. Okay. The payroll contribution can be calculated using an actuarial experience study that should take into account all applicable available data. So that's what they're going to use, how they're going to figure it out, and again, they'll set a rate that will keep the fund solvent, but it won't exceed 1% of the individual's wages. But they will be. So employers will not likely be obligated to pay anything into this fund. This is one last piece that might get manipulated a bit when the two versions of the bill, assuming they're both passed, and they'll go to conference, and there's a couple of wrinkles to work out. The House bill currently allows for an employer to contribute up to 50% of the amount that would have to be paid by the employee. Nice of them that they're allowed to. So, and some may well do that. Some employers may be able to afford that, and you know, it's an incentive anyway. The Senate bill is silent on this issue, but again, it may be. There's even talk of making it mandatory for employers to pay 50% of it. We think it's unlikely that that's going to happen. Mandate, as you know, is a very dirty word in the Republican Party, and a couple of them have already said they don't like the fact that employees are even mandated, even if employees want the program. And all indications are that 78% of workers statewide would approve of this program. I don't know where that number came from, but there's been a number of surveys done over the years that they've been introducing this bill. This is, I think, the 3rd year it's been introduced. Okay, so that, but in any case, the important thing is for employees to know that they will be expected to contribute, and but it will be a minor amount. So the last thing I want to talk about, and I'll answer any questions you have about the provision. I have the the bill up on my screen or available if you have questions about any of the minutia. But I wanted to talk some about the Family Care Campaign, because this is the statewide coalition that is working with the legislators, with the sponsors of the bill, and with their own constituents statewide to get this bill passed. And it's a very broad coalition. It's led by the Women and Girls Foundation, the Restaurant Opportunity Center of Pennsylvania, and Children First PA. They're the three lead organizations, but there's dozens of other organizations that are part of the coalition, including labor, disability advocates. Disability advocates are very, very involved at a high level and very active on this, because their folks need this kind of benefit on a regular basis. Public health organizations, even veterans groups and religious groups are active in it, and there is a website, familycareact.com. It's not up to the minute about everything, but it does give you good general information about the bill, the things that it covers, some good talking points about why it's good for business and a bipartisan issue, and there is a full, complete list of all the co-sponsors there. And so there's quite a few labor, the usual suspects, mostly public sector, SEIU, Coalition of Labor Union Women, a few others. And I've been the Philly CLUW chapter representative to the coalition. Unfortunately, we had major communication issues and I was not getting notices, so I haven't been on hardly any meetings. But happily, there was a monthly meeting yesterday, so I've got up to the minute information about what's going on, what the activities are going to be this fall as we go into this full court press to get the bill passed. So there's been quite a few meetings with legislators. There's especially pressure being put on Joanna McClinton, our Speaker of the House, and Matthew Bradford, who's the majority leader in the House, to actually bring the bill to the House floor and get it voted on. And if there's one thing that anybody, if you only have one thing that you can do, it would be to contact Matthew Bradford and ask him to bring this bill to the House floor and for a full vote. There are more meetings set up with both of them, with face-to-face meetings by some of the leaders of these organizations that are in the lead of the coalition, and we're hopeful that they're gonna come through. They're setting up similar meetings on the Senate side, and they've met with quite a few Republican senators recently who seem to be taking it very seriously. They do recognize that there's support among their constituents. They're not stupid. So even though it's not typically on the Republican agenda and not something that they promote in their platforms, there's a certain amount of common sense here, and some of them seem to be seeing the light. And in fact, a couple of the leaders were quite surprised that a couple of them brought numerous staffers, that they brought 6 people to a meeting. One of them did. So that's a good sign that there's hope. I did not go through the list of sponsors to see how many are Republicans and Democrats. I don't know all the legislators statewide, of course. The names that I recognize are all Democrats because we live in the Philly area, and there are hardly any Republicans here. So it is certainly majority Democrat, but there are some Republicans as well. And in the Senate is where we really need them, of course. It's especially hard to pass anything without Republicans voting with us in the Senate. There's a number of activities that are being planned this fall to help push this vote. There's going to be 2 in-person Capitol Days. One is October 1st and one is October 22nd. Let's see what days of the week. That's a Tuesday. They're both Tuesdays, the 1st and the 22nd. There's going to be information tables, lobbying set up, handouts for legislators and the public. And so the leaders right now are working on some themes for those materials that fit with the season. One is the sports season. It's the World Series season, and we're hope springs eternal that will hold some relevance for Pennsylvanians. So we've got a win-win-win, step up to the plate kind of things. And then also we're talking about autumn themes, don't fall behind, fall vibes, autumn leaves, and maybe have leaf-shaped handouts with slogans on them, etc. So these things are being worked up this month, especially for use on those 2 in-person days in the Capitol. Whoops, sorry, calendar fell. And I will get these materials to Laura so we can get them out statewide as soon as they're available and send them to our CLUW chapter members here in Philly too. Anyone can attend if you're available. That would be great. I'm going to try to make it to at least one of them. And in the meantime, people can do what we always can do when we're pushing for some legislation to be passed. You can call your own legislators. This is especially important for our members who are in red parts of the state and may have a legislator who was not on the sponsorship list yet. But even if they are, it would be a really good idea to call them and thank them and for sponsoring, and also to push them to push for a vote. Writing letters to the editor, posting on social media. I just posted something on the Philly CLUW page today, which was put out by Moms Rising PA, and so it's something you can click on and sends a note to these legislative leaders to advance the bill. So you can like our Philly CLUW page, and you'll find that link right there, and I'll try to put things up as they come in. Any candidate forums, there's going to be lots of candidate forums coming up, and for people running for election and re-election at the state level, as well as all these federal offices and statewide offices. And this would be a great question to ask at a candidate forum, is, where they stand on this issue, and a little introductory remarks would be great too. So anything you can do to make the issue more visible and get the word out to as many people as you can, that we're on a full court press to get this done this year, would be really very helpful. And we can tell these legislators this is a winning issue, and like Senator Tomlinson, they should run on it. It's a winner. So this is a national issue as well, and Kamala Harris and Vice President-to-be Walz have both mentioned it, at least in passing, and it has been on Joe Biden's agenda to have family medical leave paid available to workers across the country, but it hasn't been a big national priority, and it's very unlikely that there'll be any kind of federal action until a majority of states have enacted programs of their own. So we want to be part of that tipping point. We want Pennsylvania to be the first purple state. It's all blue states so far, and DC, that have passed these kind of programs. And actually, New York's is a little bit different. They have a private insurance plan that's somehow, instead of a public insurance fund, that this bill, all the other states have the same model that we're pushing here. New York's is a little bit different, but it's all blue states. So until we want to be part of that tipping point, and we want to not be among the stragglers. We were in the early days of the paid sick leave program, and here in Philly, we were, I think there were less than 20 cities, maybe less than 10 cities when we got that finally passed, and we'd like to be in the forefront of this too. We want to protect Pennsylvania's families and senior citizens and our disabled people, and this is a wonderful way to do it. And by the way, one last thing, internationally, we're so far behind. We're already a little behind in the States, but internationally, even many third world countries have paid leave for workers, especially when they give birth. Maybe not for all the scenarios we talked about here, but at least for maternity leave and disability leave. It's commonplace in the rest of the world, and time for us to catch up. So those are the major provisions, and that's what we need from you, and I'm happy to answer any questions or enlarge on that.
That's awesome. Thank you. That's a whole lot of information. I'm just curious, when you were saying it's 1%, is that 1% of people's gross income, or
That's a good,
1% of what?
I'm not, it doesn't really specify that, so I'm assuming that it's gross income, whatever tax, it's going to be like a tax. And so
Right.
it will probably be applied like any other tax is, which is typically gross income.
Okay. Okay.
But that was a question I had too, and I knew somebody would come up with it, and I wouldn't have the answer, but I'm pretty sure that's right.
Right. Okay. So, because that would be a higher hit on those who make a lot more money. So it wouldn't be like an evenly spread out amount.
No, it's going to be a percentage amount, so it's not going to be it's going to be very individualized.
Right. Okay. Okay. And Kay, did you have any questions?
No, but I work for labor and industry, so I thought this was exciting. And I definitely think it's something we should, back this year to see if we can't get it to pass. Yes.
Well, Pennsylvania CLUW and Philly CLUW are both among the co-sponsors. They just have us listed as Coalition of Labor Union Women because statewide we're in support, but we did pass it as a chapter as well. And I've been reporting on it at the chapter, but we haven't done anything. And so I'm going to try to get a group to, or at least a handful of people to go up to Harrisburg. I will probably be away on the 1st, but maybe not, I'm not sure. But there's 2 dates, and I think the voting dates that are available are after that. There's also some talk about a Halloween theme. That was another one. I think I forgot to put that in my remarks, but some of it,
Right.
Well, I posted. I work in Harrisburg.
Yeah, well, those are the dates, the 1st and the 22nd of October. They're both Tuesdays, so I guess they'll have some a room and some kind of tabling, which is usually around the cafeteria there, but I don't know that that's been set yet. I don't think they've made those reservations, but we will be having I'll be hearing more. I'll be getting information about it, and we will have another meeting before the 22nd date.
That's great. Yes, no, this is a really a very necessary program for our state and our workers. So many people, not all trades, not all fields have paid leave. I know in mine we don't. As stagehands, people of the trades, unless you have a house job within a specific building, and that building has paid leave, but on the if you're a journeyer within your union, on the trade side, there isn't paid leave as far as I've seen. So having that opportunity is a really important thing. And I'm glad that domestic violence is included. The clarifying, the partnership versus, being married, that anyone in a relationship that's, having a child, adopting a child, fostering a child, that's all really good information, good coverage. So yeah. And as you pointed out, the seniors needing help, all those things, those are, a lot of people don't think that far ahead, until you're in a situation where you do have to care for your parents, or grandparents or aunts and uncles and so forth. So yeah, I mean, I think this is a great plan. The 1% is a little rough for me personally right now, only because of what's happening in Upper Darby. But I think, as a statewide insurance coverage, I think it'll balance it out, hopefully.
Well, remember, 1% is the max it can be. So it may well be less than that, depending on, what the actuarial tables show when they crunch all these numbers. but that's
Right.
the absolute max it can be. And
Okay.
you know, and it's going to vary year to year depending on how much use there is of the fund. But you know, it's hard to predict that at this point. But you're right that the building trades typically do not have paid leave. That's true in all the building trades. And frankly, they were in opposition to paid sick days and gave us a hard time for quite a while in Philadelphia. We eventually made some progress there, I would say, but it wasn't easy, and you know, they hurt us a bit in city council for a while with a couple of the members. So, but this applies to everybody. How it's going to apply in the building trades, which is, you know, when you work out of a hiring hall, not necessarily for an employer, you know, that's going to be a complicating factor, I suppose. But maybe not. Maybe since you're insured as an individual, you collect your benefits as an individual, not depending on who your employer is. Or, you know,
So would it come out of the monthly paycheck?
Pardon me?
Would it come out of the
Yes, it'll be
employer's
deducted.
paycheck?
Yes. Yeah,
Then
the
it-
employer will deduct it. Yeah.
Okay, then that would just apply for every employer that you have. So like
Right.
I have like 15 to 20 employers at the end of the year, it would just mean it would be taken out just like any other state or federal tax.
Yes, that's right. It would.
Well, some people might forget, but unemployment is called insurance.
Mhm. It is.
So,
Yep.
And-
Yeah.
and-
Well, that's right. It's a similar kind of program to unemployment insurance. You pay into a fund when you're working, and then you collect if and when you need it. And some people will never need it. Some people will never be unemployed. Some people are blessed and never fall down the stairs, or not
Right.
blessed and never have a child, or you know. But so you know, it works like that's why it does work like insurance. It's there if you need it, and
Right.
if you don't, it's there for your coworkers when they need it. And you know, this is these kind of programs have been a high priority for CLUW for a very long time. We always talk about them at national meetings and conventions. There's always resolutions around these things. We try to support other chapters in other parts of the country that are working on these issues. You know, these kind of family-friendly programs are not just women's programs, but of course, it's women's organizations that typically have taken the lead to push them, even though they benefit workers of all stripes. And very proud that CLUW has had such a strong position on these when lots of labor wasn't involved. I mean, so much of labor, so many unions have good leave provisions in their contracts, and so it doesn't always necessarily affect them. But you know, we found besides the building trades, there were like SEIU 32BJ, for instance, that represents a lot of building maintenance and custodial workers and home health care, people like that. They were definitely the kind of workers, even though they had a union contract, that kind of provision was not necessarily assured in their contracts. And those were the first allies that we had. CLUW was often, in Philly, we were the first labor group, I think, to join the coalition to work on paid sick days. And we're the ones that brought the rest of labor into that, including the AFL-CIO, who wound up being a very powerful partner, testified in city council, and you know, and was really instrumental in bringing other unions into the fold. But SEIU 32BJ followed us quickly because a lot of their members did not have paid sick days. It was something that they had not been able to achieve in their contracts. So, you know, we've made a lot of progress on this. I mean, paid sick days is almost, you know, it probably hasn't hit Wyoming and Nebraska yet, but, you know, a lot of states and cities, you know, major employment areas have now adopted, and I don't have those numbers in front of me. I haven't kept up with that, but Family Values at Work is another great organization at the national level that has wonderful information and is really a clearinghouse for these kinds of statistics nationwide. You can find on their website which states have paid sick days, which cities have it, you know, who has paid leave, where there's legislation proposed. all that kind of thing. Have been a fabulous resource. They were all for us all through the Paid Sick Days campaign here in Philly, and they provide that kind of backup for campaigns across the country.
That's great. Is the sound really good?
Yeah, I don't know what that is. We didn't have that before.
You have an echo too.
Oh, really? I don't hear an echo. Sounds fine to me.
Oh.
All right. Well, I thought we didn't even have 30 minutes worth of material here, but I see we've gone on for 45.
Yeah.
So, well, good. I hope people watch and take action.
Yes, absolutely. So I just want to thank our sponsors again. We have Philadelphia Joint Board, Workers United, Philadelphia Council AFL-CIO, Kathy Black. We have Pam Tronser, honoring CWA Union Sisters Extraordinaire, Sylvia Ramos, myself, Laura Wentz, Best Insurance Pro LLC, Jeffrey O. Jones, Vice President of Sales. And then we do have other sponsors that will be coming up soon. We do have more series events to come in this fall, but we're finalizing the dates on them. So Tradeswomen Build the World, Rust Belt Union Blues. Then we're also going to have stuff on the elections for voter registration, voter education related issues. We have already had public sector workers, public sector OSHA with Tom Totsi, director of the AFSCME District Council 88, as well as elections based on issues, not parties. We do have links for that. I will make sure all of this information is on our PA State CLUW Facebook page, so that if anyone wants to watch any of the former ones, and then there will also be a link there for this series as well, this event today.
So will this be available immediately now or not till 10:30 tomorrow morning for people to view?
It'll be
about an hour. It'll be ready.
In about an hour, it'll be up. Okay, on that blue, whatever it is, Facebook.
Yeah,
page.
Buy Blue Shopper. I got that off Labor 411.
Okay.
American made, union made products.
Excellent. That's great. Very good.
Yeah. So I'll update the Facebook post that I made on this event for tomorrow. And I'll put the link so that, and I'll say you can watch it at any time from this point forward.
Okay. All right. Great.
We'll update it there.
All right. I'll share it. I'll send it out to the Philly CLUW membership.
Great.
Thank you.
And I'll send it out to the leaders, the same email we had last night. Or yesterday. All right. Well, thank you both so much for taking part, and Kathy, thank you so much for all your knowledge that you've just shared with us. It's just a fraction of all the knowledge in her head. She is a wealth of information and a strong advocate for us. So really, truly appreciate you still working your magic and making things happen. And thank you, Kate, for allowing us to take part in your YouTube channel. This is excellent. Thank you.
Thanks, Kate.
Yep. All right. So thank you. Everyone have a great day, and don't forget to vote. It's like
register. Don't forget to register to vote.
Register. Yes. If you're not registered, if you changed your address recently, make sure you update your address. And make sure you go out and vote in November or by mail.
Right.
Because that's important too.
Very good.
So.
All right.
All right. Okay. Awesome. Thank you so much.
Thank you both for having me. It was great.
Yes. Bye-bye. Thank you.
Okay.
Have a great day.